Yeah, I'm really, really proud of you, Mr. Burke. I just could not be more proud of everything that you've done, all the changes that you've made. It's just been absolutely incredible to watch.
It has been, man. I appreciate, and my other doctor, my primary doctor, Dr. Jonathan Miller. He is just amazed by it, and he was like, man, he told me, and you told me it was going to be a life change. And my surgery was in December 17th, and since that time I've lost like 315 pounds. So I'm getting around so much better. At one point in my life, I was walking very limited. When I would go to even grocery stores, I had to ride in a cart most of the time. And so now I'm walking it, and I'm walking it it's just wonderfully. Uh, I'm breathing much better. My overall health has just improved. I don't no longer have to use an oxygen tank. I no longer have to be on a CPAP machine. It's just something that's just been an amazing change from the time I got out the hospital up until now. And I just can't say any more about the progress that I continue to make because it's still coming off. It's look like every week or so, it's another 5 to 10 pounds that I've lost. My appetite has gotten better to the point where I'm eating much more healthier food choices. The trash that I was eating, I don't even desire it anymore. So it's mostly good steamed vegetables, or cooked vegetables, fruits. I do a lot of smoothies, steamed food like seafood, which I'm a lover of seafood. But anything fried is very limited. Any carbs are very limited. And that's a great thing for me because I was just eating myself to an early grave, before this procedure. I had an older sister that I lost late last summer to lupus. And that's my only thing, which really, it just really hurts me that she's not here to see me because all she knew was the big 700-pound John. And so I wish she was here now just to see me because I know she'd be stunned.
Yeah, absolutely. I was kind of going back through my records, and you and I first started talking about weight loss surgery back in September of last year. I
Yes.
don't know
Okay.
if you remember that.
Yeah.
Yeah, and I was just going to say, we talked about a number of different options, and you can refresh my memory if it's not correct, but I think you came in to see me wanting a duodenal switch. Somehow you already knew about that.
Let me tell you, I can tell you exactly how I knew. I was trying to get the weight off last summer, naturally dieting and exercising, and it was coming off, but not quick enough. Not it was because doing it that way will take time, real time, and you knew how big I was. So for my weight, it was going to take a lot of time for it to come off. But anyway, I was going to Pro Health gym. And I was sitting in the waiting room. I was swimming. I was taking swimming classes there, water aerobics. And I was waiting on my ride to come one day. And I was sitting in the waiting room. And this lady came in. And I was telling her about my health and how I was trying to lose my weight. And she said, well, I had weight loss surgery. And she told me, she said, I went to see, yeah, I was this size and whatnot. And she was a small lady. And so she said, yeah, I went to Surgical Associates. And she said, they wonderful. That's a wonderful group that you got to. And I was just like, okay. And she gave me the information. And I researched you. I got up on Google and researched Surgical Associates, and it came up. And that was one of the procedures that I saw out. They said, these are the different types of procedures we can do for you. And a duodenal switch. And I read up on it. And I said, I never heard of this one. I've heard of lap band and gastric bypass, but what's this D switch about? And he was telling me how it combines and does this, that, and the other. And I was like, okay, and it also said this is for the really obese, which I was in that category. And so I said, this is the one. This is what I got to have. And I immediately set up the appointment with you. So yeah, I came in the office already No, and you didn't take it. We didn't ponder a long time about which procedure. You told me straight up, John, the only thing gonna work for you is the D switch.
That's what you need.
That's
Yeah.
what you told me. You said, because my BMI, I don't even remember the number. It was so, I mean, it was so high. You was like, I can get you. And I remember you had that calculator in your hand and you was punching some numbers. And then you stopped and you said, well, in about a year or two, I can get you down to 200. And because my dad was with me, and we were like, what? And you said, but it's going, and at first you didn't, the only thing you was concerned about the D switch, you didn't know if you had to do it in two different procedures.
2 stages, right?
And so, but yeah, from day one, I walked in the office knowing what I wanted.
Yeah. Yeah, that's exactly what I remember. When you came in, you knew what you wanted. You had researched it. You studied it. You know, and I remember your dad being there. And you know, you're a young man. You were 600 plus pounds. I hope you don't mind me saying.
Oh, I don't mind. That's
600 plus pounds. Very young, just over 40 years of age. But significantly debilitated.
It was terrible, man.
Congestive heart failure, high blood pressure, sleep apnea.
All that. And my Dr. Miller, my primary doctor, he had been telling me though for years. He said, John, you got to do something about your weight, because one day you're going to wake up and not going to be able to get out of bed. And that happened last summer. I got up to go to work and couldn't move. And then I was falling as well. I fell 3 times. Fire department had to come and get me off the floor, and I couldn't get up off the floor. Everything, every little thing that people take for granted was a serious task to me, like getting out of bed, like walking to the kitchen and back. Anything like that was really a chore for me to do. And I'm just so, and now, man, to see me move, it's just amazing. I'm blessed to be here to tell you all the story.
It's pretty amazing, honestly. I mean, so you came in, we saw you in September, and you probably had already been seeing your primary care doctor for a period of time, because we did your surgery in December 17th. So normally people have to wait about 6 to 8 months from the first time I see them.
Right. It was because my insurance wouldn't cover the surgery, Dr. Ringold. And so that was a big surprise. Because see, me and my dad, we went to see y'all financial people about it. It was like, well, you can get it financed. And I'm not going to, I don't necessarily tell the price of it, but it wasn't nearly as bad as we thought it was going to be. I will say that. And so the other thing too, and when we talked and you found out I was going to be paying cash for it, you were like, you said, I know I hate your insurance don't cover it, but it's still going to be worth it. It's still going to be worth it. To live, you're going to get another 20 to 30 years out of your life. At least, you know what I'm saying? If you take care of yourself from this surgery. So it's going to be worth it to do it. And my dad, he was on board, and he's not big on spending no money now. He was on board immediately. He was, and I was like, man, it's just like a car payment here. I can do this. And so, but yeah, that's right. I was a cash patient, but it was so worth it, man. I don't regret anything right now. I have no regrets about it.
Well, I can tell you, and you and I have talked about this a little bit, but the day that I brought you in for surgery, December 17th, we took you back, and we did the procedure. And, you're a 41-year-old gentleman, young organs, young body, should be very healthy, but that weight was taking a toll on your body.
It was killing me.
And I put the telescope in and I looked, and, there were liters and liters of abdominal fluid from your congestive heart failure. Your heart was decompensating. Your heart was having a hard time at 41 years of age, and it was getting ready to shut down. But we did the procedure. Procedure took just under 3 hours.
Oh, really? I didn't even know
Um,
that.
yeah,
I didn't know.
procedure went great. You did great.
Yes, sir.
Stayed in the hospital for several
Yeah, I had to
days.
stay in there almost a week. That was the only because, and normally though, and I think you correct me if I'm wrong on this, but people usually stay in there what 2 or 3 days at the most.
Usually 2 days.
Okay, and they had to keep me because my breathing still, of course, wouldn't cooperate. And they were still watching my heart, which I still see a cardiologist about, because I do suffer from SVT. But it's under control. I don't have any episodes from it in a long time. But I still get that monitored. But yeah, just going back a little bit about how quick we did, from the time I saw you in September to December doing the surgery, paying the cash. The benefit from that was that I didn't have to do all the unnecessary stuff to me, the red tape, so to speak. Go see a psychiatrist and go see my doctor for 6 or 7 months straight and all this stuff. So I bypassed all that. Basically, I skipped the line.
Yeah, yeah, you really did.
That's what I did. I skipped the line, and that was just great. It was like God was like, "Man, we got to get you on that table quick."
Well, so when you and I talked, I told you, Mr. Burke, I do gastric bypass, I do duodenal switch, I do lap band, I do sleeve, what have you. And, you had already decided on duodenal switch. I think that was obviously the best choice. But one of the things that I always look at when I talk to patients about these procedures is how much weight are you wanting to lose? How much weight do we expect for you to lose? And what would be best for you as a human being to lose? And so you mentioned earlier, I got my calculator out and we started talking about it. And typically anybody with a BMI over 55, I'm going to recommend a duodenal switch because those procedures, that the duodenal switch procedure allows you to lose the most weight. And your BMI was 88, I believe, was my recollection when we started. And so you really need to lose a pretty good amount of weight to get your BMI under 40. And that's my objective. People that undergo duodenal switch will lose the most BMI points. And look at you now. I mean, you're not even 4 months out, and you've lost, 39 BMI points. So you've gone from a BMI of 88 in less than 4 months down to a BMI of 49. You've lost 313 pounds so far, probably more now since I saw you last week.
Probably another 2 or 3 pounds since then. So yes, man, it's just been wonderful, man. I mean, yeah, can't explain it. It's just been wonderful. I recommend it to anybody who's in that situation. I really would, and I recommend you do it quick as you can. Because it's just gonna come off. It just fell off like that first month. I lost 200 the first month after surgery, and then yeah, but you told me it was gonna slow, and I'm glad. It's slowing down, of course, but it's still coming, still going off. And so, but yeah, man, it's great.
And we're still expecting you to lose probably just over another 100 pounds.
I've been trying to calculate that because I'm trying to calculate now. I think a month in a month's time now, it's around 25 to 30 that I'm losing. And so I'm trying to calculate by Christmas what I would probably be. So I'm trying to get around 240, 250 by Christmas. I think I can beat that.
Absolutely.
Yeah. So.
And what is your overall goal? What would you like to get to?
I think 230, 240 is where I want to stay around. But see, I'm going to be a lot of that's going to be muscle because I'm going to hit the gym. I'm hitting weights. I want to put on some muscle, and really transform. But yeah, that's my goal, man, to get down around 240, 250. Because everybody asks too, like, well, John, when it's gonna stop? When you gonna stop losing? You just gonna disappear? So I said, well, I was told by the doctors that your body just knows, how to level off. It know how to level off. And like I said, it took the longest for my appetite to even come back after surgery. In my mind, I was thinking I can eat that prime rib when I really can't no more. And so it just in the last 3 or 4 weeks, I still don't, of course, don't eat a lot because my stomach only holds so much. But I just in the last 3 or 4 weeks started to get my appetite back, which you said will happen. You said, John, it's going to come back. At first, I was taking it. I would go days without food. I was doing all the water. I still do a lot of water, but I would go days without food at times. But now I eat every day, but it's like one meal, and then the rest of the day is water.
Well, I'm just so proud of you, my friend. I really am. It's just been an absolutely wonderful journey. And you're not just getting started, but you're in the beginning stages of all this.
I'm going back to work. Just got on with a new job and starting working in about 2 weeks because I can get around now, and it's just wonderful, man. I appreciate everything, dude. I really do. There's nothing else I can do to make up. I mean, for you know it, but I got to tell you, you saved my life. That's what you really did.
You're very kind, my friend. You're doing all the hard work. Well, you've been an absolute delight to take care of, and I really appreciate you taking time, Mr. Burke, to do this for us today.